Immunoassay for analyte other than infectious agent antibody or infectious agent antigen, qualitative or semi-quantitative, multiple-step method. Qualitative or semi-quantitative, single-step method, e.g., reagent strip. Quantitative, by radioimmunoassay, e.g., RIA. Quantitative, not otherwise specified. Immunoassay uses highly specific antigen to antibody binding to identify specific chemical substances. More specific methods reported with these codes include enzyme immunoassay, EIA, and fluoroimmunoassay, FIA. Insulin, total. This test measures total insulin, which includes both the protein-bound and free hormone present in the blood. Method is radioimmunoassay, RIA. Insulin, free. This test measures free insulin. Free insulin may also be referred to as active or unbound insulin. A fasting blood specimen is obtained by venipuncture. Method is radioimmunoassay. Intrinsic factor. Intrinsic factor, IF, is a glycoprotein secreted by the gastric glands and necessary for the absorption of vitamin B12. Method is guinea pig intestinal mucosal homogenate, GPIMITE, or radioassay. Iron, Fe. Iron binding capacity, TIBC. Method is colorimetry or atomic absorption spectrophotometry. Isocitric dehydrogenase, IDH. This test may be abbreviated as ICD or IDH. CSF is obtained by spinal puncture. Method is enzymatic or colorimetry. Ketogenic steroids, fractionation, 17 kgs. Ketosteroids, 17 ks, total. Urine specimen collection is performed over a 24-hour period. Method is colorimetry. Ketosteroids, 17 ks, fractionation. This test may be ordered as 17 ks fractionation. Urine specimen collection is performed over a 24-hour period. Method is column chromatography or gas liquid chromatography, GLC. Lactate, lactic acid. Specimen collection is CSF from a spinal puncture or arterial or venous blood. Method is enzymatic or gas chromatography, GS. Lactate dehydrogenase, LD, LDH. Isoenzymes, separation and quantitation. The test is a measure of LD or LDH, which is found in many body tissues, particularly the heart, liver, red blood cells, and kidneys. Methods used are lactate to pyruvate or pyruvate to lactate. In 83625, this test may be ordered as LDH isoenzymes or LD isoenzymes. 3 serial blood specimens are collected at 6 to 8 hour intervals to detect changes in the LD isoenzymes. Lactoferrin, fecal, qualitative. Quantitative. A random stool sample is obtained and preserved in enteric transport media. Method is enzyme-linked immunosorbent assay, ELISA. Lactogen, human placental, HPL, human chorionic somatomamotropin. This test may be called maternal serum HPL. Specimen collection is obtained by venipuncture. Method used is radioimmunoassay, RIA, or turbidimetric latex immunoassay. Lactose, urine, qualitative. This is a diagnostic urine test to identify the presence of lactase in the small intestine. Method is gas chromatography. Lead. This test may be ordered as PB. Method used is source dependent, but commonly electrothermal atomic absorption spectrometry, AAS. Bronchoalveolar lavage specimens may be tested by X-ray fluorescence spectrometry. Fetal lung maturity assessment, lecithin sphingomyelin, L/S, ratio. Foam stability test. Fluorescence polarization. Lamellar body density. Specimen collection is by amniocentesis. Method used is thin layer chromatography, TLC, and a 1D or 2D approach may be specified. In 83662, this test may also be ordered as pulmonary surfactant or the shake test. Method involves diluting amniotic fluid with ethanol and shaking the specimen. In 83663, the amniotic fluid is analyzed by fluorescent polarization, FPOL. A fluorescent phospholipid analog is added to amniotic fluid and its fluorescence polarization is measured using a fluorescence polarimeter. In 83664, lamellar body density is calculated by measuring the number of surfactant-containing particles per microliter of amniotic fluid. Method is automated cell count. Leucine aminopeptidase, LAP. This test may also be ordered as LAP or leucyl aminopeptidase. Methods are commonly colorimetry, fluorometry, and enzyme assay. Lipase. This test may also be called triacylglycerol hydrolase. Method is often by turbidimetric, a specialized processor. Lipoprotein, A. This test may also be requested as LP, A. The patient is instructed to fast for 12 hours prior to this test. A blood specimen is obtained through venipuncture. Lipoprotein, A, is measured using an enzyme-linked immunosorbent assay, ELISA. Lipoprotein-associated phospholipase A2, LPPLA2. This test is also ordered as a PLAC. The test measures an enzyme called lipoprotein-associated phospholipase A2. The specimen is blood serum or plasma. The PLAC test is typically a microplate-based enzyme-linked sandwich immunosorbent assay. Lipoprotein, blood, electrophoretic separation and quantitation. The patient is fasting. Venipuncture is performed to obtain a blood sample. The test is performed using electrophoretic methods on plasma using a homogeneous gel to separate particles based on size. Lipoprotein, blood, high-resolution fractionation and quantitation of lipoproteins including lipoprotein subclasses when performed, e.g., electrophoresis, ultracentrifugation. This test may be referred to as type 3 fractionation. The patient is told to fast. Blood is drawn by venipuncture. The test may be performed by various methods including ultracentrifugation or electrophoresis. Lipoprotein, blood, quantitation of lipoprotein particle number, S, e.g., by nuclear magnetic resonance spectroscopy, includes lipoprotein particle subclass, ES, when performed. The test is performed on plasma, acquired by venipuncture. The patient is requested to fast prior to this test. Lipoprotein, direct measurement, high-density cholesterol, HDL cholesterol. This test may be requested as HDL, high-density lipoprotein, HDLC, or HDL cholesterol. Lipoproteins are compounds composed of lipids bound to proteins, which are transported through the blood. This code reports direct measurement only, normally performed using an enzymatic or precipitation method. Lipoprotein, direct measurement, high-density cholesterol, HDL cholesterol. This test may be requested as HDL, high-density lipoprotein, HDLC, or HDL cholesterol. Lipoproteins are compounds composed of lipids bound to proteins, which are transported through the blood. This code reports direct measurement only, normally performed using an enzymatic or precipitation method. Lipoprotein, direct measurement, LDL cholesterol. This test may also be referred to as LDLC. It measures the amount of low-density lipoprotein, LDL. Method may be by precipitation procedure with results derived by the Friedewald formula. Lipoprotein, direct measurement, LDL cholesterol. This test may also be referred to as LDLC. It measures the amount of low-density lipoprotein, LDL. Method may be by precipitation procedure with results derived by the Friedewald formula. Luteinizing releasing factor, LRH. This test may also be referred to as the LHRH test. Methodology may entail administration of a stimulation agent with a baseline blood sample drawn before the injection and several after. Samples may be tested by immunoassay.